So today we're going to talk about what happens when an individual has gained a lot of weight and the different things that they might be able to do about that.
Well, that's actually a very important question because, the number one, what has recently been chosen as the number one health problem in the United States is obesity right now. And a lot of people, and in fairness to the obese, okay, we're definitely figuring out that there's more of a genetic component to this than people think. There really is some truth to saying, I kind of have a harder time than this person over here who weighs 90 pounds. And so that's definitely true. Obviously, always the best way to lose a massive amount of weight is diet and exercise. That's always the best way. But again, throwing that genetic component, it becomes really hard to do that sometimes. And so there are surgeries for that. Gastric bypass is one of them. I do not do that. But there are bariatric surgeons who specialize in gastric bypass. And you may ask, well, okay, how does gastric bypass work? Okay, well, how it works is there are many different ways. Okay, it's not any one way. They can do a little lap band, so they just kind of strangle the stomach, and you feel more full when you eat, and then when you're full, you stop. They can actually remove parts of the stomach. That is actually the best way. But it is a much more risky surgery. And then there are other ways to kind of hook up the intestines and things in various ways. So it can be somewhat complicated. But there are different ways to have this kind of bariatric or gastric bypass surgery. But they all work from the general principle that the patient will feel more full quickly. And in fact, in some of the ways, they can't even eat that much. I mean, it's just not possible. But it is possible to gain some of the weight back if they switch to pure liquid diets and things like that. Sometimes happens. But after gastric bypass surgery, most commonly patients will lose large amounts of weight very rapidly, 75, 100, 150 pounds. That surgery, by the way, is better for people who are very obese. It's not for someone who's just a little bit overweight. It's not for someone who's 10 or 20 pounds overweight. That's for someone who's 100 or 150 pounds overweight would be a much better candidate for that type of surgery. Other ways to lose weight, there are some medical ways that will help you. Currently in Nevada, some of the laws are changing with that, but there are some ways where you can see physicians. They can give you certain supplements or things that might help you with your appetite suppression or other means. I'm not going to talk about those right now because some of the laws are changing on that, and I don't want to get too involved with that. But diet and exercise is the best way. The problem is, and I didn't know this until I became a physician. You assume, and here's the problem: you assume that after you lose 100 pounds, you'll be just like before you gained it, and that is not true. Unfortunately, skin elasticity. Women who've had babies, we've talked about this, know about it, but skin elasticity will not bounce back if you've lost massive amounts of weight, and you will need my help in that area.
Well, this is all really great information, and I know next week we're going to talk about what you can do once you've lost that weight and you have lots of loose skin and how you can help people with that.
All right, thank you. I look forward to next week.